Hello, I'm Minseung Kim from South Korea. I'm going to present about radio frequency microneedling, RFM. Okay, let's get started. Although topical therapy as well as invasive treatment have their specific indication in skin treatment, methods that stimulate the body's and skin's own regenerative mechanism have nowadays gained popularity. The use of small needles for percutaneous collagen induction, which is the popular in reticular dermis in a purely mechanical way, the microneedling is one of them. Each individual microlesion is perceived by the skin as an injury, but since the epidermal barriers gets minimally disrupted, and scarless wound healing will occur. This wound stage is characterized by the presence of transforming growth factors, which can be traced immunohistologically and highlights the activity of non-inflammatory wound healing. Microneedling has been the subject of several clinical trials investigating its effects on transdermal drug delivery, acne scar, pores, skin rejuvenation, burn scar, striae, alopecia, melasma, and so on. It has been compared to other treatments like fractional lasers, topical products, and peelings, and so on. The penetration of the skin that is caused by microneedling can also serve as a way to deliver topical products or radiofrequency without causing unnecessary damage to nearby structures. Products like platelet-rich plasma, PRP, and human stem cell conditioned medium, and so on, are used to enhance the mechanism of percutaneous collagen induction by delivering extra growth factors, while others are combined with microneedling to enhance their penetration and effects, like minoxidil, depigmenting serum, and tranexamic acid, and so on. The delivery of radiofrequency through the insulated or non-insulated paired microneedles proved to improve the aesthetic appearance of atrophic acne scars, aging skin, and acne vulgaris, and so on, and showed to be superior compared to the effects of bipolar radiofrequency or needling alone. It demonstrates beneficial effects on inflammatory lesion, which contradicts the commonly used exclusion criterion for microneedling, that it has the presence of active skin infection and inflammation. This criterion excludes patients with active acne, which is often still present in patients with atrophic acne scars. The electromagnetic spectrum consists of radiation in the form of waves. RF waves do not have enough energy to cause ionization of biological systems. Primarily, the effects are thought to be secondary to thermal mechanisms. RF medical devices conduct electric currents to tissues in repetitive pulses, and the energy delivered causes oscillation and vibration of charged particles against tissue's resistance. This kinetic energy is converted to a thermal energy. As you know, time-temperature relationship of heat determines the characteristics of a response. At 44 degrees Celsius, irreversible damage enriched after 7 hours. Conversely, at 70 degrees Celsius, transepidermal necrosis results in less than 1 second. In middle temperature, like 44 to 51 degrees Celsius, injury doubles for each degree rise. But obviously, besides time and temperature exposure, the behavior varies with differences in tissue composition. Devices parameter like frequency, mode, power, or pulse settings, size or configuration of delivery tip, and tissues characteristic like hydration, temperature, and so on are significant variables of the thermal effect. Radiofrequency microneedling, RFM, is a minimally invasive treatment that creates perforation in the epidermis and delivers radiofrequency-generated thermal energy into the underlying dermis. The application of RFM have expanded to include treatment of acne vulgaris, acne scars, surgical scars, facial rejuvenation, axillary hyperhidrosis, striae, more and more. Today, I'm going to present briefly about some indications I use. I have 3 kinds of RFM devices, and I usually use a device named VIVACE because of its convenience and effectiveness. VIVACE offers a safe and effective treatment for acne and acne scars in all skin types. Because RF is not selectively observed by chromophores, so it is safer in darker skin, like Asian. This procedure offers minimal downtime compared to fully ablative treatments for acne and acne scars, although typically at least 2 to 3 times RFM treatments are necessary for full results. As you know, in multiple trials, RFM has been shown to help with active acne lesions and acne scars. RFM has also been effective at decreasing sebum production. Acne scars are also common complaints among patients presenting to us. Many higher quality studies showed RFM to be a safe and effective treatment modality for acne scars. Non-invasive fractional bipolar radiofrequency delivers bipolar RF to cause dermal coagulation and remodeling by pin electrodes in contact with the epidermis, rather than microneedles penetrating the skin, and which results in some concurrent epidermal ablation. Comparing RFM with urban glass non-ablative fractional laser for atrophic acne scars, both modalities had a similar efficacy, but RFM was more tolerable, had less downtime, fewer adverse events, and safer, especially in darker skinned individuals. Radiofrequency microneedling can be used safely in combination with urban glass, CO2 fractional laser, and other RF treatment to augment its efficacy. Many studies found that the addition of RFM to urban glass, CO2, or RF resulted in an improvement in acne scar over monotherapy. Among the acne scar subtypes, boxcar scar and rolling scars tended to show the better response to RFM, whereas ice pick scars tended to show the least response. I almost always use VIVACE in rosacea patients. Rosacea is a chronic inflammation disease of the sebaceous glands that presents as persistent facial erythema, flushing, and occasionally papulopustular lesions. Topical and oral antimicrobials are often the first-line therapy. With a rise in antimicrobial resistance, however, we are looking for alternative treatment options, or to make the treatment result better, or to make it faster. Many studies evaluated RFM for rosacea improves in severity and a significant reduction in the subjective symptoms of rosacea. It is believed that papulopustular variant of rosacea had a greater treatment response than erythema-to-telangiectatic variant of rosacea. But of course, we can get good results telangiectatic rosacea too with RFM. The improvement from RFM in rosacea are believed to result from the anti-inflammatory, anti-angiogenic, and antimicrobial effect of RFM-induced dermal remodeling. The mechanism of RFM had been suggested as remodeling of dermal structure and decreasing sebaceous gland activity by the thermal effect of radiofrequency energy. However, it was found that RFM may have anti-inflammatory and anti-angiogenic effects because NF-kappa B and interleukin-8 and VEGF decreased in vivo after RFM treatment. The expression of VEGF is upregulated in the lesional skin of rosacea patients, and NF-kappa B can upregulate interleukin-8 and VEGF expression through binding to the NF-kappa B sites of the promoter of these genes. Although a detailed mechanism of regulating NF-kappa B by RFM is unclear, the results of this study show that RFM can reduce inflammation and angiogenesis in rosacea. Furthermore, the decrease of markers related to the innate immune system like TLR2 or LL37 was also observed after RFM treatment. This regulation of the innate immune system is thought to be important in the pathogenesis of rosacea. Although the exact mechanism remains elusive, mast cell count decreased after RFM treatment, which could be a possible pathway to reduce inflammation and angiogenesis. Melasma. Laser toning using a low fluence 1064 nanometer Q-switch Nd:YAG laser is one of the most frequently used treatment modalities for melasma. However, this therapy is time-consuming because it requires a lot of treatment sessions, and sometimes hyperpigmentation or PIH, rebound hyperpigmentation or refractory case occur. Microneedle RF could be effective in the treatment of melasma because it can improve the impaired extracellular matrix of skin, which is commonly found in a melasma lesion. It is also expected that through the microneedling effect, transepidermal elimination of melanin and drug delivery through the skin barrier can be increased. Therefore, the combination of microneedle RF and Q-switch Nd:YAG is synergistic and better than Q-switch Nd:YAG monotherapy. These are transmission electron microscope images of the epidermal layer, and it's very interesting. A and C are images of the epidermis after combination therapy. B and D are images of the epidermis after laser toning therapy. Red arrows show loosening of melanocytes. Image A and C show increased loosening of melanocytes and adjacent epidermal cells. The mitochondria, the red circles, were more edematous, and the number of microvesicle was greater after a combination therapy than toning alone. This is a paper published in 2017 about melasma and rebound hyperpigmentation. In this study, Dr. Kim Young-moon aimed to determine the clinical efficacy and the safety of treating melasma and PIH with RF treatment. In 142 patients, RFM treatment was delivered at a frequency of 2 MHz and with non-insulated penetrating microneedles over 5 to 10 treatment sessions at 2 to 3 week intervals. Melanin is not believed to be influenced by RF treatment, but Dr. Kim suggests that morphological or functional melanin structures are directly changed upon RF irradiation of melasma or pigmented lesions. The electric properties of melanin have been shown to be somewhat unique, displaying both electrical conductivity and photoconductivity. And we know RFM is good to induce wound healing. If high-energy laser treatment target the BM, after which ependylus and melanocyte could shift downward into the dermis. Because RFM stimulates healing of the basement membrane, we can use RFM to thicken and heal damaged basement membrane for improvement in PIH or rebound hyperpigmentation. RFM accelerates washing out of dermal melanin, followed by stimulation of neocollagenesis. And improved dermal environment helps boost melasma and PIH treatment results. So I always use VIVACE to patients with melasma and PIH. If RFM is used together to treat melasma, the results are better, and the side effects such as PIH or rebound hyperpigmentation can be much reduced. There are many other uses besides I presented. RFM can be used in combination with various treatments or alone and will have quite good results. This is a treatment video from Dr. Emil Tangeri. I'd like to finish my presentation with Dr. Tangeri's treatment description. The patient is holding a kind of air blower to reduce the pain and cool down. And this patient received a CO2 fractional laser right after VIVACE treatment. And having these two treatments at the same time may not give any problem for white people, but for darker skinned people, combining such treatments should be cautious.
Hello, this is Emil Tangeri. I'm a dermatologist in Sacramento, California at the Center for Dermatology and Laser Surgery. My assistant, who's a nurse, is performing a VIVACE treatment, which is an RF microneedling device on the face of one of our patients. Again, this device is bipolar. It sends energy in between selected pins in this device, causing thermal damage in the subcutaneous tissue. We're treating the upper face of one of our clients. We're using a setting that's generally between 0.9 and 1.2 millimeters on the upper face. and this is enough to give us damage in the papillary reticular dermis and also some of the deeper structures. We use an RF level of 6, a pulse duration of 600, and we try to use a 1 megahertz setting at the beginning. We have a 1 and 2 megahertz settings. The 2 is less vigorous. We generally use a topical anesthetic, lidocaine, or you can use a triple combination before this to provide anesthesia. We are performing this, you can see, at a very high density, which is a 50-50 overlap, which gives us in one series of passes at 50-50, in essence what you'd get with 4 passes. During the treatment, if the patient is having discomfort, we sometimes can change to the 2 megahertz setting or take the RF level down from 6 to 5. You can see the patient is tolerating the procedure well. We generally try to stay on bone in this area here and are careful to be always on bone around the orbit. You will show some a before and after this. It's usually done a series of 3 to 4 sessions. We are at this setting using an uninsulated needle, which is effective at giving us some superficial as well as deep damage. Conversely, you can use an insulated needle, confining the damage down deeper. We generally also use something superficially to wound the skin as we're doing this, so we often combine this with a fractional picosecond, fractional CO2, and other treatments to enhance our results.
Thank you for your attention and have a nice day. Thank you.